Hi, my name is Mahesh Ramachandran, or as everybody calls me, Dr. Ram. I am the Chief Medical Officer at Marianjoy Rehabilitation Hospital, part of Northwestern Medicine. Today, we are going to be talking about rehabilitation of the COVID-19 patients. COVID-19 patients have multiple manifestations of the disease. They have psychological trauma. They've been through a very traumatic time. Their loved ones and family members are typically unable to visit them at the hospital. What we're seeing from a medical standpoint are those patients that are elderly and or have morbid conditions such as diabetes or hypertension, or those patients that are immunocompromised. They are quite deconditioned, and thus they have tachycardia, they have hypoxia. About 30% have neurologic manifestations. Part of the program at Marianjoy includes intensive neuropsychological as well as spiritual care services to provide a holistic approach to treatment, to provide coping techniques and other techniques to help them deal with these fears and anxiety. One of our primary goals is to take the medical problems and incorporate our therapeutic plan. Our therapeutic plan has to be comprehensive because of the multiple manifestations of the disease. Each therapy program is individualized. One of the most important aspects of at Marianjoy is the rehabilitation nursing that is provided to all patients and especially to COVID-19 patients. Our nurses also are very important for that holistic approach to care. At Marianjoy, we're very proud to have dedicated therapists in physical therapy, occupational therapy, and speech therapy. We aggressively approach problems of the spirit and mind as aggressively as we do the patient's physical deconditioning. We've introduced new and rigid safety protocols. These protocols are designed to not only protect COVID patients, but all the other patients at Marianjoy, as well as the staff and our employees. We have made strict procedures with regards to the recommendations for the PPE equipment, for their isolation precautions, and having a dedicated team in taking care of these patients. It's safety first. Whether it's a patient or an employee, we want them to feel safe while they're here. We have 3 different areas that we have to address before a patient gets safely discharged home. Number 1 is what is the family support at home. In addition, with COVID-19, there are a lot of fears, not only from the patient, but now the family as well. There needs to be a lot of education, so both the patient and the family members feel safe. And the third aspect is what are the next steps for the patient. Typically, they're not back to fully functional level when they leave Marianjoy. So then we set up possibly a home health therapy program and or an outpatient therapy program to make sure there's a continuation of their progress even when they do go home. We have outpatient services that involve physical therapy, occupational therapy, and speech therapy. We offer leading-edge technologies such as virtual reality as well as robotics. We use all of these techniques to help enhance patients' functional recovery. To those patients that come to Marianjoy feeling that there's no hope, probably the most important thing that we can provide here is that hope. From a spiritual standpoint, from a physical standpoint, and a mental standpoint to help improve all aspects of their care.